Hello, my name is Dr. Paul Shazza. I'm Associate Professor in Pharmacology at Durham University, and my career in Parkinson's spans 34 years. In 1988, I was part of a team that purified the dopamine receptor, the D2 dopamine receptor, the main target for some of the main drugs that we use to treat the symptoms, the motor symptoms of Parkinson's. In the last 20 years, we've been working on symptom relief with a number of drugs and strategies to combat symptom relief. And finally, in the last couple of years, we've been working on developing drugs in the disease-modifying area of Parkinson's. The last 21 years, I've been associated with the Parkinson's UK Durham branch here with some of our members at charity walks for funding support for Parkinson's research over the years. So over the last 20 years, as I said, we've been working on the non-motor symptoms largely, and we've been focusing on my favorite molecule, which is here on the left-hand side, which is histamine. And we've been looking at various important symptoms within Parkinson's, other than motor symptoms, namely attention deficits, working memory, narcolepsy, daytime sleepiness, and delirium. And more recently, we've been strongly working in the area of chronic pain, which is a major symptom, a non-motor symptom of Parkinson's, understudied and under-evaluated. And we've developed a range of drugs, both targeting the brain, in the case of Wakix, and targeting outside the brain in the case of these two drugs, Votrient being the most advanced compound. So as well as non-motor symptoms, we've been also thinking of other ways to combat pain, as this has one of our major areas recently. Using biopsychosocial approaches, we developed a program in helping GPs deliver chronic pain management in primary care, and we've developed other strategies based on virtual sites. And this is a virtual site we developed, the Footsteps Virtual Pain Festival, in the last year, which you can see is a range of activities that have been developed to help in terms of health and well-being, in terms of pain management, in terms of staying active, in terms of creativity, in terms of also engaging with nature. So this is a free festival site, and it's perfectly designed for people living with Parkinson's, also their carers, and also potentially any other members of the public. Finally, our main goal recently, and an exciting project that we've been developing, which hopefully we're working on being a game changer in terms of treating and slowing down the disease progression within Parkinson's, and potentially stopping it and potentially curing it. And this diagram, complex diagram, shows you how this drug can potentially do that. It can give you what we call the 3 N's: neuroprotection, neuroplasticity, and neurorepair, it all built into the same molecule. So, in conclusion, my career over the last 34 years, and more recently, has been designed to develop and change attitudes in Parkinson's, and ultimately, more recently, to find a cure. Thank you.